Раз.
Доброго дня усім гостям.
Good afternoon to everyone, to our guests and our online viewers. We have the briefing on the start of European Immunization Week in Ukraine and Parents are Superheroes campaign. Our guests are Olha, Stefanyshyna, Deputy Minister of Health of Ukraine, Vladyslav Zbanatskyi, Deputy Director General of Center of Public Health at the Ministry of Health, Ms. Giovanna Barberis, UNICEF representative in Ukraine, Niyazi Cakmak, Director for Immunization System Strengthening World Health Organization. Our speakers are welcome. Good afternoon, dear colleagues. Thank you to everyone who attended this briefing and joined us in this section, Parents are Superheroes. After the briefing, we will go to Maidan Nezalezhnosti along with our colleagues. We will be wearing costumes of superheroes. We will be talking to the public on the topic whether the general public vaccine themselves and their children. So after this briefing we will go and have an action. I would like to congratulate you on the start of European Immunization Week in Ukraine. We will have very many events. We start with this briefing this week. I would like to give my example. Being a mom, I have two children, 6 and 8 years old. 2 weeks ago we went to the outpatient clinic and I immunized my child against measles, mumps and rubella. I saw many doctors and my doctor said she is very glad that I have the records which are perfect, the immunization record, and she was very surprised. The doctor said that I am a unique mom with so good record of immunization. The level is low in Ukraine. The coverage by vaccination is low. For recent 5 years we have unstable situation where the contagious diseases spread, but they are preventable by vaccination, while adults and children are dying of such vaccine preventable diseases. We should stop this. What we need for this, we need availability of vaccines. For 10 years we have problems with supply of vaccines. In 2014 the situation became better, became worse. The tenders were conducted too late by the Ministry of Health for supply of vaccines. Now the situation has changed. We have very positive information today in all regions of Ukraine. All vaccines needed for the immunization are available in Ukraine as of today. What we are doing to maintain this good situation, the Ministry of Health have already developed the methodology of counting how many doses of vaccine we need in Ukraine, and UNICEF fund has helped us with this and continue to provide us assistance. This methodology supposes that Ukraine will plan the need, the demand for 3 years. And we also will have a buffer pool so that we do not experience any longer any lacks of vaccine doses, and the calendar of vaccination, it should become more comfortable for parents so that they can do immunization within one time, within one visit. I would like to address all moms all vaccines which are available in Ukraine, they are high quality, efficient and safe, because this is UNICEF which has bought them for us, and they have been tested and qualified by the World Health Organization. There are two factors which depend on the Ministry of Health Care, and thanks to these factors we can suppose that the situation with the immunization coverage will be better. And also there is a third factor which depends on highlighting this issue by mass media. The journalists should assist us with public awareness campaign during this year, so that we help our moms not to be afraid to immunize their children, so that they have more fear that the children can die of infectious diseases, but not of vaccination. In 2014, the percentage was 63%, the coverage was. We now experience more coverage with information. Minimum 95% of children should have all immunization doses made in time. Thank you. As a mom of two children, I would like to call on all parents to address this issue responsibly. You need to go to the outpatient clinic and do all your vaccinations. I'm giving the floor to Mr. Vladyslav. Good afternoon to everyone. I will continue the topic of Miss Olga. I am parent of a small daughter. She has perfect vaccination record, so follow us and join and vaccine your children. Our topic is the European Immunization Week. This topic is extraordinary for the national security. This is not only the phrase which is set forth in the Constitution, and the health of every individual depends on the health of community. We can look at the outbreak of measles and see how vaccines can save lives. In 2016, 45% of children under 1 year, only 6% of children were vaccinated, and under 30% of children under 6 years were immunized. So we should have the indicator 93 and 90% by in 6 years. The situation is very bad with the vaccination against diphtheria, pertussis and tetanus. Very small percentage of adults are immunized against diphtheria. All adults are here who have been vaccinated recently. After 26 years of age, every 10 years, every adult should go and get a booster dose of DTP vaccine. The same concerns polio. Only 75% of children are vaccinated against hepatitis B. Only 50% of children are immunized. The lack of vaccines previously was experienced in our country, and also there were myths in the mass media sources which also influenced the population. That is why why we have low level of vaccination coverage, and now jointly with the international partners we have mended the situation. We have enough vaccine doses in all the regions of Ukraine. I call on all of you, go and immunize yourself and your children. We start the European Immunization Week with this briefing. There will be very many events during this week. Today in the Galician region, the NGO Parents for Vaccination will hold the event. There will be an exhibition of children's pictures on Wednesday, on 25th. The Public Health Center and Elena Lukashevich will have the briefing and the speech, and the Parents for Vaccination will hold the meeting with the Dr. Tatiana Rybakova on Thursday, and on Friday there will be a briefing, and on Saturday there will be a master class, the School of Vaccination. This is a new project and MBA platform. For adequate coverage of this topic, you can use the resources of our website, where you can see updated, monthly updated on the number of vaccinated persons, and the website of the Ministry of Healthcare, where also the issue of supply of vaccines is covered, and also our international partners websites. Thank you.
Good morning to everybody, Deputy Minister, colleagues. It is a great pleasure to be here today and to launch, together with the government and partners, the European Immunization Week. This is always an excellent opportunity to keep discussing and sharing information about vaccination and raise awareness of parents, of health workers, of the public in general on this very important issue. Vaccination is the most powerful prevention when it comes to some infectious diseases, and generally vaccination saves around 3 million children's lives a year worldwide. The availability of vaccines has improved significantly. I mean, the Deputy Minister has mentioned that. Today we have availability of vaccines according to the calendar everywhere. When it comes to MMR, we are very happy to announce also the arrival just a couple of days ago of additional 800,000 doses. So this will help significantly in addressing the current outbreak. It is true that in spite of all the efforts, we still have some challenges. There is no doubt, but the situation overall has improved according to our survey, a survey that we have done recently in 2017. 84% of parents said that they would follow or try to follow the national vaccination calendar, compared to the 63% in 2014. So there is some progress. And again, also when it comes to the vaccination against MMR, definitely the coverage has improved, but we are still not there with the 95% recommended coverage. Today, I mean, as already you have heard, we are really appealing to all parents and families to bring your children to the health center and to get your children to be vaccinated. You need to really push and comply with this recommendation because especially when it comes to MMR, the outbreak of measles outbreak is still very much out there. Also, you have to take care of yourself. You know that every adult in Ukraine is entitled to free revaccination against diphtheria and tetanus every 10 years, so you can get yours and make sure your family is protected. I would like to also invite everybody whoever has doubts or has questions to consult with those that are reliable sources, such as the Ministry of Health, the World Health Organization, and us. So not to generate any misinformation. I would like also finally to share a little success. We are celebrating this week with the presentation of a new children's book written by the author Babkina in cooperation with UNICEF and the publishing house Nigolov. This will be distributed to all kindergartens in Ukraine, and it's about telling your children about viruses, bacteria, and that can defeat them. So the book is here. We are launching it today and will be really reaching all preschool children in the country. This is a great tool for sharing and information to children as the best vehicle of information also for the families. Thank you very much.
Thank you. Mr. Niyazi Cakmak, the floor is yours.
Good morning, dear media representatives, colleagues from the Ministry of Health and UNICEF country office. Welcome to European Immunization Week, which has started today and will go throughout this week. So not only Ukraine, but all European countries, together with the other regions, are celebrating Immunization Week this week. It's mainly to raise awareness of the importance of immunization for people's health and well-being. Since its inception in 2005, the European Immunization Week has grown into a widely recognized event carried out predominantly by the region's member states, involving WHO country office, partners, health ministries, professional associations, parent organizations, and many others. The initiative's aim is to sustain public demand and political support for immunization through advocacy and targeted communication and educational activities. The European region countries enjoy overall high childhood immunization coverage and is progressing towards achievement of goals of European Vaccine Action Plan, including elimination of measles and rubella, besides eradication of polio. Unfortunately, the benefits of vaccination are spread unevenly in the region, with far too many children missing the protection they deserve. In 2016, 1 out of 15 infants in the region missed their measles-containing vaccine, and 1 out of 21 did not receive recommended 3 doses of diphtheria, pertussis, tetanus vaccines. Such gaps in coverage have led to avoidable disease outbreaks in the region. This year, European Immunization Week's theme is vaccination is an individual right and shared responsibility, with the aim to close immunity gap so that benefits of vaccination are equitably extended to all people. The challenge of not being able to spread the benefits of vaccination evenly is much greater in Ukraine than any other countries.
Так як і в інших країнах в регіоні вищі рівні імунізації і низький рівень вакцинації на рівні регіону, він має бути 95% для того, щоб не було епідемій, і 90% на районному рівні. В Україні невакцинованих немовлят 55%. Національна програма імунізації покращується, і вона спрямована на покращення зусиль Міністерства охорони здоров'я та партнерів програми, як пояснив.
My problem has been successfully addressed and vaccines are made available for use of public health. But the challenges are still there, particularly when it comes to reaching all the eligible children in the country. To achieve the set targets, extending the benefits of vaccination equitably to all individuals, we must intensify our efforts in Ukraine. As I mentioned, Minister of Health has successfully addressed the vaccine availability supply issues, but now it's time to focus on building trust to immunization, so that individuals understand the value of immunization services and vaccines and demand vaccination as their right. Building trust in immunization is our collective responsibility. We must unify our efforts in disseminating key messages to public and healthcare professionals. We should all know that vaccines are safe. Vaccines work to protect people of all ages from potentially dangerous diseases. Every person deserves to be protected from vaccine-preventable diseases, and each person play a vital role in protecting others by choosing to vaccinate. When all eligible individuals are fully vaccinated, those who cannot be vaccinated are also protected through herd immunity. Consult with your doctor and check your family immunization records to make sure that you are fully protected. False information can influence choices and endanger lives. Get the facts, share only evidence-based information about vaccines. Health professionals are the most trusted source of information about vaccines for their parents. Raising awareness about vaccines saves lives. Immunization protects individuals and communities' health by preventing diseases, by avoiding consequences of diseases such as disability and death, by allowing people to live longer with better quality of life. By protecting health, immunization also helps us to achieve the Sustainable Development Goals. In other words, immunization does not only protect individuals and communities from vaccine-preventable diseases, but also contributes to economic development. Reduced sickness leads to healthcare savings, therefore contributes to economic development. Reduced sickness avoids catastrophic treatment payments due to severe consequences of diseases and decreases poverty, thereby contributing to economic development. Reduced sickness increases productivity of individuals and reduces the burden on caretakers, thereby contributing to economic development. Reduced sickness increases school attendance, improves learning, cognitive development, thereby contributing to economic development through a better educated workforce. These are known wider benefits of immunization. $1 investment in immunization provides $44 return on investment. So this is the cost effectiveness ratio of immunization. No other health intervention is that much cost effective than immunization. Immunization is not the only most successful and cost effective health intervention ever, protecting children and families from suffering and death. It is a human right and key element in ensuring health, education, productivity, and economic development. Let us unite our efforts in building trust in immunization so that benefits of immunization are equitably extended to all individuals. And every individual understands the value of immunization services and vaccines and demands vaccination as a right. Throughout the European Immunization Week, as announced earlier, there will be plenty of events to raise awareness on immunization. I would like to add one more. Tomorrow, together with the leading specialists of Ukraine, we are going to organize a forum. We will be discussing how we can engage them to the process and how we can support Ministry of Health's efforts in restoring the immunization program performance in Ukraine. Thank you very much.
Thank you. Шановні колеги, зараз маємо час на 4 короткі запитання і прохання сьогодні запитання.
Thank you. Today, please, we will be talking your questions. Welcome. I have question to Ms. Stefanyshyna, Deputy Minister. Where vaccination and immunization is most successful in Ukraine and what regions are less successful? Thank you for your question. Good question. The immunization coverage differs by regions of Ukraine. We have a select virtual meeting with the heads of regions on the low coverage of measles, rubella and mumps immunization. In Odessa region, the situation has improved, but it is still bad. The coverage is low. Please address the Center of Public Health for the statistical data. They have all figures. Next question, please. No questions. Then, I would like to remind you that we have 2 moms and 1 dad and other people. We will go now and promote vaccination in Krещатик and Maidan Nезалежності Street. You are welcome to join us. Thank you.